In this section, we will discuss the Z drugs, BDZ antagonists, and antidepressants that act as anxiolytics and hypnotics. Zopiclone, zolpidem, and zaleplon, so-called Z drugs, have shorter half-lives than the BDZ. Mouse mutation studies have shown that zolpidem and zaleplon have a selective action on the alpha, 1 subunit of GABA receptors. They all have reduced propensity to tolerance and have less abuse liability. Zaleplon has such a short half-life that it can be used to treat middle-of-night insomnia as long as a 5-hour period elapses before driving. In the absence of ligand, most receptors are believed to be in a resting state, but BDZ receptors are appreciably activated, even when no ligand is present. Inverse agonists are anxiogenic because they close activated BDZ receptors. Antagonists do the same thing, and this may explain why BDZ antagonists, like flumazenil, are sometimes anxiogenic and very rarely cause convulsions, particularly in epileptics. Flumazenil is a competitive BDZ antagonist that has a short duration of action and is given intravenously. It can be used to reverse the sedative effects of BDZs in anesthesia, intensive care, diagnostic procedures, and in overdoses. Moving on, we will not be going into much detail about antidepressants. We will only focus on them from the perspective of anxiolytics. Antidepressants, especially selective serotonin reuptake inhibitors, SSRIs, are used in the treatment of most types of chronic anxiety disorders. Antidepressants have a slow onset and may increase anxiety for several weeks before beneficial effects are seen. Where a rapid effect is required, for example, in panic disorder, a BDZ may be given for a short period. Now, let us talk about drugs acting at serotonergic 5-HT antagonists. Serotonergic 5-HT cell bodies are located in the RAF nuclei of the midbrain and project to many areas of the brain, including those thought to be important in anxiety, like hippocampus, amygdala, frontal cortex. Experiments on this part of the brain have suggested that 5-HT antagonists might be useful anxiolytic drugs. These are buspiron, chloral hydrate, and clonithiazole. Buspiron, a 5-HT partial agonist, has a slowly developing anxiolytic action in humans, perhaps by desensitizing somatodendritic 5-HT receptors. Buspiron is not sedative and does not cause dependence. Unfortunately, it is only anxiolytic after 2 weeks of administration, and the indications for buspiron are unclear. Chloral hydrate is another drug that is converted in the body to trichloroethanol, which is an effective hypnotic. It may cause tolerance and dependence. Chloral hydrate can cause gastric irritation, but it is less likely to accumulate than the BDZs. It is little used nowadays. Clonithiazole has no advantage over short-acting BDZs, except in the elderly, where it may cause less hangover. It is given by intravenous infusion in cases of acute alcohol withdrawal and in status epilepticus. Clonithiazole causes dependence and should be used only for a limited period. So this brings us to the end of this lecture, but do not worry, we will talk about antidepressants in detail in the coming lectures, so keep an eye for that. In the meantime, keep watching more pharmacology videos on sqadia.com.